lighting up awareness for the #1 killer cancer among women in Singapore. The Breast Cancer Foundation is urging women to take charge of their breast health as it kicks off a campaign called The Health Crisis That Was Always Here. The Fullerton Hotel in the heart of Singapore blushed pink in a show of support. Minister in the Prime Minister's office, Indrani Raja, shed light on some statistics. Each day, 6 women are diagnosed with breast cancer, and 1 dies from it daily.
If it's diagnosed at stage 1, the chances of full recovery are actually over 90%. So it's very important that women are aware that you should check for breast cancer. If you from age 20 and above, please do self-breast examination. From age 40 upwards, you should go for regular mammogram checks.
To tell us more about the campaign and the importance of mammograms and self-examinations, we're joined by Staphnie Tang, President of the Breast Cancer Foundation, and Dr Wong Chiung Ing, Senior Consultant in Medical Oncology at Parkway Cancer Centre. Thank you very much, ladies, for joining me this evening. Staphnie, I want to start with you. What prompted your team to draw parallels between COVID-19 advice and breast cancer awareness in the campaign messaging?
Yes. So with COVID-19, people are paying more attention to their health. So we saw the opportunity to remind women about breast cancer, which is a deadly health crisis that we need to fight together. So we worked with our creative agency and they drew parallels between COVID-19 advice and breast cancer awareness. So indeed, the health crisis that was never here is our team campaign this year. And it actually lends a twist to what seem like routine COVID-19 messages, such as washing your hands, flattening the curve, and then we put the spotlights back onto breast cancer and the importance of early detection.
Dr. Wong, the campaign this year is aimed at getting women to do monthly self-examinations as well as to go for regular mammograms. From what age should women start going for these screenings, and what should they be looking out for when they do these self-examining?
Okay, so the risk of breast cancer increases with age, with the highest incidence in women who are aged 50 to 59. However, the peak incidence of breast cancer in Asian women tends to be younger. So we peak at about 45 to 50. Therefore, breast cancer screening should start at age 40 for us. All women aged 40 and above should go for annual mammogram. So every year until they are age 50. And if this is normal, they can do this every 2 years. There are some patients who are an exception. People with strong family history of cancer should actually consult their doctors, and and their screening regimen may be a little bit different. As for self-breast examination, that's also very, very important. We should start as early as age 25. And essentially what we need to do is the few steps of feeling, touching, and looking. So what we should do is that we should look and feel for breast lumps. We should look at our change in size and shape of the breast. We should actually also look at the color or change of the skin and look at our nipple, make sure that it's not retracted, and squeeze them to make sure that there's no bloody or colored discharge.
And Dr. Wong, we know that early detection, as you mentioned, that can help in the patient's chances of survival, but how can we tell if we are of high risk of developing breast cancer? Beyond just screening and self-examinations, is there anything else that we can do?
Yeah, so besides being female and increasing age, which are factors that we cannot change, one of the things that we should be very vigilant about is family history. If you have a very strong family history of cancer, be it breast, colon, ovaries, pancreas, prostate, you have to be very careful because there may be an inherited cause of breast cancer. The proximity and the age of your relative who have been diagnosed of cancer is also important. So if you have a relative who is diagnosed at a very young age and have a close relationship with you, then that rings an alarm bell that there may be an inherited cause. There's a mutation in the gene that may increase our risk of cancer, of any sort of cancer. But thankfully, there are some modifiable factors that we can use to reduce our risk of cancer. And as we know, about 80% of breast cancer are actually stimulated by hormones. So if we can modify our lifestyle to decrease the hormones levels in our body, then we have a chance to reduce the risk of breast cancer. And this includes things like limit our alcohol intake, modify our diet, make it rich in fruits and vegetables, low in red and processed food. We should not be overweight. We should have maintain a regular physical activity, and if possible, we should actually have a child before 35 and breastfeed our children.
Staphnie, coming to you, aside from patients, caregivers too often face a lot of stress after a loved one is diagnosed. Do you have any tips for caregivers out there who are supporting those battling with breast cancer?
So you're not alone in your own journey as a caregiver. And I think unique to Breast Cancer Foundation, we actually have a caregiver support group. So this is actually a safe place for them to share their own emotions, their experiences, and a place for them to ask questions and get more information on how to cope. So at Breast Cancer Foundation, we actually have this line, shared courage, together we are stronger and we will overcome together.
Well, thank you both for sharing your time with us this evening. We've certainly learnt a lot. Staphnie Tang, President of the Breast Cancer Foundation, and Dr Wong Chiung Ing, Senior Consultant in Medical Oncology at Parkway Cancer Centre.